This video is how to roll the hip. So we're going to focus on tensor fascia lata, the lateral hip here, glute medius, piriformis, and glute max. After you've rolled your plantar fascia, you want to move on to the Achilles and calf and soleus, or gastroc and soleus. You want to put as much body weight as you can tolerate. So you want to lift your hips off and move very slowly, working all the way from the very base at the back of your heel all the way to the back of the knee, making sure that you get the inside as well as outside. Additionally, you want to roll your iliotibial band, the lateral quad here, so you would get in a side plank position just like this, and you have to work fairly posterior here because the muscle runs all the way back here. It's not just on the side here. So you've got to roll just like this all the way from the knee to your hip. So in this particular instance, I'm referring to the hip as the greater trochanter. There's a bone on the side here that sticks out. Then there's your iliac crest, this kind of thing that runs through here. So you only have to roll to here, so from your knee to here, because once you get above that, you're going to use a ball in that upper part there. So quad would just be like this, rolling all through that area. I'm going way too fast, but the how video is linked below. You can use more intense rollers. That PVC pipe is the most intense you would use. If you can tolerate that, you will get better results by using that. Once you get higher up, then you can still use a tennis ball or something like it. If it's too intense, if you can tolerate that, then move on to something harder that you're going to get a little bit more results from. So I would get into your piriformis, which is right in the center of your glute. Then once you've done that, and you can do some of the active release technique, or at least do the best you can with that, you can move on to glute medius, which is, if you put your hand on your hip like this, it's where your thumb hits there. So if your piriformis is here, and that bone in your hip on the side is there, and that iliac crest is here, it's right below that. So when you put your hand like that, your thumb is right on that spot. So with the ball right there, just like this leg straight, right on that spot. It should hurt pretty intensely when you do that. For rolling, that's probably all that's needed through the hip. If you hit all of those spots, you'll be feeling a lot better after each workout.